Hello and welcome. My name is Chris from ChristopherHall.com, and welcome to this video where we're going to be talking about injury rehabilitation and what you can do sort of immediately after the injury. We're going to be looking at two different principles, RICE and POLICE. RICE is the more well-known. POLICE has its benefits, and we're going to be talking about that in the next video. Now, if any of the symptoms of your injury are prolonged, then obviously please go and see a, a health or medical professional to give you more specific advice on how to rehabilitate your injury. But with that in mind, what we're going to talk about first is RICE, and then in the next video we're going to be talking about POLICE. So RICE, first of all, rest. The first thing to do for up to 24 to 48 hours is to keep any weight off the injury. So more strain placed on the injury can cause more pain. It could cause adverse healing, and it may increase the risk of abnormal repair as well. So you may get additional scar tissue. It may extend the period at which the rehabilitation takes, so on and so forth. So first thing to do is rest. The next thing to do is ice, which decreases blood flow to the injury and therefore inhibits bleeding and also bruising. It reduces pain, it neutralizes local histamines and decreases muscle spasm. So within that first 24 to 48 hours when you are resting, you want to be placing an ice pack or something iced, be it cold peas, whatever it may be, for 10 to 15 minutes at a time. Now, that doesn't mean you do it for the full 24 to 48 hours, but you may just take, I don't know, 2 rounds. So you'll do 10 minutes or 15 minutes of holding the ice on there. As the injured site cools and the pain begins to decrease, you would then take that off. As it begins to warm up and possibly becomes a little bit more painful, you would then reapply the ice. Now, you may only do 2 to 3 cycles of that, but you would do that several times over that first 24 to 48 hours. Next comes compression. Now, the aim of this is to again reduce the swelling, which can inhibit function of the joint. So you want to wrap the injury. Now that may be for example, around the ankle. It may be in an ankle strap, or it may be using a bandage. If you are using a bandage or an ankle strap, it doesn't want to be too tight because again, that can have adverse effects on the injury, increased pain, so on and so forth. And then the final one in this 24 to 48 hours is elevation. So you want to raise the injury above your heart, which allows gravity to help reduce swelling. And you want to elevate periodically, much like with the icing. You want to periodically do it over the first 24 hours. So hopefully now you've got a better understanding of RICE. What we're now going to do is we're going to talk about POLICE, which is the next way of managing an injury.